Welcome to our seminar on CMIs, and what we'll do is do a little bit of a tag team between Michael and I remotely, and hopefully we'll be able to address any questions that you may have. So the topics that Michael and I will be doing a little bit of a tag team today, and what we're going to be looking at is, of course, the new CMI template. And so between the two of us, Michael will first provide a little bit of the background as to the template. Those of you that may be aware of it or may have used it will know that the template didn't just appear overnight. There's a lot of background research that was involved with this template, including research that was conducted probably about 9 years ago through a government grant that was conducted through the University of Sydney. And we really use some of those learnings to develop the new template. So Michael will present on that section. I'll then go into some of the main changes with the template. So there's three main buckets that have been changed. The first obvious one is the summary page. There are language changes, and then the third one are the formatting changes. So I'll present on those and provide some tips for CMI writers. I'll then hand back to Michael, who will go through the regulations and how the TGA have amended the regulations to allow for the new CMI template. Also provide you some details on the guidance and the advice, and then where we're at for next steps. Please ask your questions as we go through, and Michael and I will then meet after the formal sessions to then discuss the questions and address those for you. So next slide, please, and over to Michael.
Thank you very much, Sylvia. As Sylvia flagged, I'll be discussing a little bit about the new CMI templates in the first instance. Specifically, I'd like to go through a little bit of the history, a little bit of the background of how the project got started, the CMI Improvement Template Project, and just step you guys through the process that was undertaken in the early parts. So issues with CMI, particularly amongst consumer groups and consumer stakeholders, is a bit of a tale as old as time. It's been well recognised that there's been areas that could be improved with regards to CMI for quite a long time. That stretches back 10, 15 years at least, if not longer. And some of the challenges of this project was that we had a ministerial imperative to create an improved template, but we had seen in the past that a lot of efforts had been undertaken that didn't end up resulting in any great amount of change or improvement. So one of the first principles of this project was not to go back to first steps all over again and work from the ground up, but rather taking some of the work that had already been achieved in the past, some of the investment in time, energy, and also money into previous studies, and using those as a foundation to start with. So in particular, there was the ICMI program that was conducted under the Fourth Community Pharmacy Agreement with the Pharmacy Guild that was conducted by the University of Sydney, and that had extensive surveys and consumer surveys, and one of the outcomes of that project was a template, suggested improved template for CMIs, as well as some other recommendations. Fast forward a few years after that, when there was still hadn't been any major changes in the CMI space, the Electronic Distribution Working Group, of which Sylvia is the chair, they conducted their own pilot study around CMI, and they also produced a template. So at the beginning of last year, that was when some more media and community concerns with regards to the quality and effectiveness of CMI was being raised. The Minister gave us a direction that he wanted us to fix it. So the TGA convened a stakeholder forum in February. A lot of the major stakeholders that we could identify were invited to that, and there was a lot of in-depth and a very strong, so robust, I would say, discussion about this topic. And one of the decisions or agreements coming out of that stakeholder forum was agreement to develop a new format, to develop a new template, and you base it on the templates that had been developed as part of ICMI and that EdWig pilot study. So we had a place to start, and it was agreed that new template developed out of that process would then be taken to user testing. So the TGA engaged ThinkPlace, a consultancy, and also enlisted the expertise of Dr. Parisa Aslani from University of Sydney and her team to user test this new synthesized template. In the beginning, we picked 3 products: Ultra Pro Breeze Haler, TGA, and Plavix. These were specifically selected. They had these were all products that were belonged to sponsors who had representatives on EdWig, so we had a bit of a head start in that regard. They were also selected very importantly because they were just different dosage forms, one being an inhaler, one being an injection, one being a tablet. And they also, as a result of those different dosage forms, had varied complexity. So we wanted to be able to test our new template in lots of different sort of contexts. As part of the user testing, we did 3 rounds of user testing, and we made iterative improvements between those testing sessions, and that was used to both work out what was most valued and appreciated in the new template and what needed further work or what perhaps needed to be further changed. And that user testing resulted in an evaluation report which we published on the TGA website, which has I've provided the URL there on the screen. So that's been published now for well over 9 months, so people can have had access to that for some time. I'll just hand back over to Sylvia now to discuss. Sorry, it's me. The new CMI templates. We engaged with key stakeholder organisations in targeted consultation before and after using. User testing was conducted, and then we made changes based on that feedback as well. So I said that we had a stakeholder forum in February. Well, that was followed up with another stakeholder forum in, I believe it was July last year, that went through the evaluation report from the user testing, and then that's how we ended up coming upon making a few further changes to the template, which included the development of a prescription template and a non-prescription medicine template. So there's 2 different formats. So as Sylvia had indicated in the intro, one of the biggest changes was that there was a new 1-page summary. That 1-page summary was determined was not necessarily appropriate for all non-prescription medicines, and as such it's been determined that that should be optional for non-prescription medicines. It's still encouraged. It was user tested and found to be very valuable and appreciated by consumers. So if your product is a non-prescription medicine, you can still have a summary. You're just not required to have one. There was also minor changes made in recognition that there's differences between scheduled products. One of the big ones is when in the instructions for what a consumer should do when they're taking a medicine, when they want to stop taking a medicine, well, in the prescription medicine template, it encourages the consumer to talk to their doctor before they stop taking the medicine, whereas that's not appropriate for an over-the-counter product. So there's little changes made in the template to reflect that. The final CMI templates and additional guidance was published in April this year and is available at that link that's now on the screen. Now I hand over to Sylvia to discuss, to present on the main changes in the new templates.
Thanks, Michael. So like Michael explained, the main changes within the CMI, these arose, so before I go into what the 3 main changes are, they did arise from the research. So this is what consumers told the researchers that they wanted in order to make it a little bit more user-friendly and also looking at making the focus of the CMI in reducing complexity and improving the readability for consumers. So there are 3 main changes when you look at these. The first is the 1-page summary, the second is the language, and the third are your formatting changes. So I'll take each of those changes in turn and provide a little bit more background. So with the 1-page summary, is a summary and you only have one page. So it's like a piece of real estate. This is the area you have to work with, and we have tried to write the one-page summary with some of our complicated products and ones that have multiple indications as well as a lot of side effects. And it is possible to do it within the one page. You just really keep it to a minimum and make it as succinct as possible for the patient to be able to visually see what are the main points within the CMI. So that's the first change you'll notice. The second one is the language, and this is probably where a lot of the detail and a lot of the work is involved in either rewriting current CMIs or writing a new CMI. You will notice that the language is actually in very plain English. It doesn't involve any medical terminology, and it's very clear. The sentences are very short and succinct. The use of the active language is also within the CMI. So instead of saying tablets are stored in the refrigerator, it will be store the tablets in the refrigerator. So very direct language. The language is also consistent throughout the CMI so that the terms are not mixed, and that way it ensures a clear message to consumers. It's also really important to not confuse health literacy with education. So there has been evidence of low health literacy within the community, and research has shown that time and time again. And it's not confused with education. So we've had user testing performed on people with tertiary education. So in fact, lawyers, accountants, or other professionals that are not within the health industry, and you'd be surprised to see how low the health literacy levels are within that subgroup of patients. So the language is actually really important, and that will probably be a lot of the work that you will find in rewriting the CMIs. So it's not like the PI project where you can simply cut and paste and then move sections around and your headings. It actually involves a little bit of work in rephrasing sentences and also using appropriate words that are much more simple for patients to understand. The third main change are your formatting changes. So the first thing that you'll notice with the CMI is that there's a lot more white space to make it a little bit more visually appealing to consumers. The information has been restructured, and there's use of headings as well as subheadings. You'll also notice that the headings have a black shading with white text to clearly pull out which are your main headings. There's use of bold, which was also within the current CMI, but now we're trying to just focus it more on the important things to look at. And the other thing that came out of recent research that was done through ThinkPlace and the University of Sydney was the use of tables. And you'll notice this particularly within the side effects section. So side effects have been broken up into less serious and serious, and they've been separated by the tables as well as the action. So that's not too dissimilar to what is in the current CMI, where you're splitting them into less serious and serious, and then what a patient should do. So for a less serious, it says please speak to your doctor if it worries you, and then your serious are, get yourself to a hospital or see a doctor immediately. The other point is parts. One of the main advantages also of this new CMI template is that it has been digitally enhanced. So what that means is that under Regulation 9A of the Therapeutic Goods Regulations, we can provide CMIs either as a pack insert or in another manner, which includes electronic distribution. So the digital enhancement of these CMIs allows sponsors to create external links, such as if you have a subcutaneous injection, you can provide a link and then show the patient how to use that subcutaneous injection. And often patients, they understand it a little bit better when they can visually see what they need to do. So that's been a major advantage, and really thinking forward in terms of being able to make those CMIs digitally available either at point of dispense or on people's iPhone, where they're able to just use their camera scan and then have that information available to them at their fingertips. So they're probably the three main bucket of changes within the current CMI compared to this new CMI template. When we look at the overall changes, and the aim behind it is to really make use and ensure consumers have access to safe and appropriate and making safe and appropriate decisions, and mainly removing that repetition and decreasing the length of the CMI. So the real focus is reducing the complexity and improving the readability for consumers. The TGA, as Michael discussed earlier, have issued a guidance document. And we really want to stress that it is a guidance document. It is not prescriptive, and there are sections within that CMI that may not be applicable to your particular product. So if your injection or your infusion, for instance, is a one-off infusion and it's only given at hospitals, then of course the section on storage would not be appropriate, as would the section on overdose. So therefore those sections would be removed. So the guidance document is as such a guidance document. And those of you that have probably written CMIs over the years would know that it's as much an art as it is a science, and the side effects section is probably the difficult section to write, and there is no right or wrong. It's just a matter of making the language appropriate for consumers to understand. Michael, I'll hand back to you for the next section.
Thank you, Sylvia. Yeah, just reflecting back on some of Sylvia's points about the main changes, I just want to reiterate again Sylvia's point about the focus being on consumers and what they need and what they require from the information provided in the CMIs. That was the impetus behind the need to improve the template, improve the format, is that consumers were finding whether or not they even knew that CMI existed, but if they did, they were finding those documents weren't meeting their needs and wants for the type of information that they were wanting about their medicines. So the focus when you're writing and using the new template is very much that separating the activity from what you as the sponsor or what we as the regulator, how we engage with this information, and focusing rather on what the consumer needs and how that language needs to be changed and adapted for their benefit. One of the key points about the next section on regulation, the regulation change, hopefully it will be clear that we haven't made a really radical change here. All the changes in the template and also in the regulatory requirements are more evolutionary in nature than revolutionary. They're not radical changes, and whilst we're not looking, whilst we're regulating to make sure that all sponsors are able to effectively and adequately comply with the regulatory requirements, we really want to encourage sponsors to look at trying to improve CMIs for the consumer experience, so that that the consumers are getting the best value from that document, that the energy that they put into looking at those documents bears fruit, and they're able to better understand how to safe and effectively use their medicine. So in terms of the regulation changes, we made an amendment to the to Schedule 12 and 13 of our regulations. Schedule 12 relates to prescription medicines, and Schedule 13 relates to non-prescription medicines. They're very similar in nature. I won't get too deeply into them because they're actually quite repetitive. But what we have, one of the important parts to understand is that the general requirements in the regulations are unchanged. It still lists under the new regulations that a CMI must be A, written in English, B, be clearly legible, C, be written in language that will be easily understood by patients, and D, be consistent with product information about the product. So the important part about D, and something that I have heard some feedback from sponsors around, is concern about how do they appropriately align with the product information in the CMI. The important part to understand is that it doesn't need to be duplicative of the product information, and it doesn't have to be comprehensively reflect every piece of information that's in the product information. Product information is obviously for prescribers and health professionals so that they can make the proper and correct decisions about using the product. But what the information in the CMI needs to do is pull across the information that's relevant to consumers without bringing across the information that will either confuse them or they're unable to engage with, but that information is consistent with, it doesn't disagree with, it doesn't contradict the information in the PI. It's not that it needs to be all of the information from the PI. I think the important part there also is that this is no different to the previous regulatory requirements for CMI. We haven't changed this section at all, or this part of the regulations at all. So the new parts of the regulations is that the CMIs must now set out all the information required by the applicable templates. So we actually cut out a lot of stuff out of the regulations that sort of expanded upon the different types of information that should be included, and instead we've pointed to the template and said if it's in the template, if there's a heading in the template, then the information should be about your product should appear in your CMI under a similar heading. But importantly, our new template doesn't ask for or require any new or additional information compared to the previous format. Sure, there's a summary for prescription medicines and optional for non-prescription medicines, but that information still isn't new. It's just a summary of the information that previously was being required in the CMI. So there isn't any, we're not asking sponsors to develop new information to be added. But we are asking sponsors to think very hard about how they can improve CMI and improve that experience for consumers and improve the effectiveness of that communication for consumers. My background is as a professional writer, so I have certain advantages in trying to take information and translate it in a way that is suitable for general audience. And I understand that some sponsors may not have a similar level of a resource kind of like me in their organization. That's the sort of level of investment that needs to be made to ensure that this information is fit for purpose. So also within the regulations we have both for prescription and non-prescription medicines. If the CMI, this is one of the big exemptions that was made as part of our consultation. If the CMI is enclosed within the packaging, that is, if it's in the box, or in some cases we heard of products where the CMI was stuck, glued to the outside of the packaging. If the CMI is enclosed within or similar with the packaging, then it's not required to have the summary. It's also not required to set out the information in the same order as the template. It still has to have all the information, all the types of information that's required by the template, but it's not required to have the summary or the same order. Now, in saying that it needs to include all the types of information required by the template, that's the same as the previous regulatory requirements. So we understood that the regulatory burden of trying to radically change or alter your CMI that is being inserted into packets, if that's part of a regulatory requirement that the TGA or as part of your RMP or any of those sort of other requirements, we understood that that was probably too difficult given the size constraints and the practical constraints of inserting a large piece of paper into what's a relatively small packet of medicine. So those considerations have been made. We've made those exemptions. If the CMI is supplied in electronic form, we have asked that we have required that it be available in PDF or HTML format. And that's just because those formats are the ones that are most commonly and easily accessible for consumers. So for non-prescription medicines, as I mentioned before, the summary is optional. but it's still encouraged. The important thing here is that the summary has been user tested with consumers and it received very positive feedback. So even if you have a non-prescription medicine, if you think a summary won't be impractical, and that is that some non-prescription medicines already have very short CMIs, and a summary on a very brief CMI would be quite duplicative. If you do have a longer CMI, and there is information where you think the consumers might benefit from having a summary attached to the front of your CMI, then we also encourage you to please consider creating a summary as well, even though it's not a regulatory requirement. So a summary, if required, as Sylvia said, it can't be any more than one page. And I can't stress this enough, and I know this causes a little bit of angst because this is probably the most difficult element of this activity, is summarizing a full CMI down to the information on the one page. But I'd just like to point out, because I know it's been raised before, and I even thought so myself in the development of this project, that in the template, it already looks like the page is full. So how do we put information into that template and make it fit? The important part to recognize is that at the top of the template, there are some not optional, but there's some pieces of text that are only included if they're applicable. That includes the black triangle wording. That includes the warning if there's a boxed warning included in your CMI if it's required. Then you might need to include these pieces of writing. If those don't apply to your product, they're not going to be in the draft. So you're already getting 4 or 5 lines of text freed up there. You'll see if you actually look at the summary template, there isn't a lot to actually add in. It's mainly like a roadmap. It's almost like a table of contents that allows the consumer to see the most critical elements of their about the safe and effective use of the medicine. It's not comprehensive. The summary is only to be supplied with the full CMI, so it does not have to be comprehensive. You can leave things out. You may have a product that has a lot of side effects, potential side effects. Well, it might be a case that you just summarize those side effects. You might say that there's certain types of side effects that people need to be aware of, and they need to look at the full CMI to see further details. It's important that the summary only includes the most critical information about safe and effective use of the medicine. You might sometimes have to make some hard choices. I'll now want to discuss a little bit about the guidance and advice that the TGA we have provided on the website. One of the things, and Sylvia mentioned this before, is that the template itself is guidance. There's no way to produce a template which is a one-size-fits-all. There was no way to produce a template that sponsors would be able to open up, cut and paste in the name of their product and call it a day. That's not practical, that's not feasible. It's not what the previous template did, it's not what the new template can do either. What the template does is provide it's a tool like any other piece of guidance that allows sponsors, will hopefully help sponsors create a better, more effective CMI relatively easily. So also on our website, we've got a document called TGA CMI Template Guidance for Sponsors, and that specifically provides advice on compliance with the regulations. So that was a newer piece of guidance that was produced just to help sponsors understand that some of these points that I'll get into in a minute. There was an earlier piece of guidance that was produced as part of the user testing project, which was more about key communication principles, about plain English writing, about avoiding jargon and things like that. So the two documents are designed to be companion documents. One is about how to write well, and the other one is about how to effectively comply with the regulations and make a good CMI that also ticks all the boxes for us from a regulatory perspective. So getting down to those points is that the templates and guidance are not prescriptive. As sponsors, you're still responsible for the content of your CMI, and you still have significant discretion in what you put into your CMI and how that is worded. As I said before, your CMI needs to be consistent with your PI. There needs to be all the important information in your PI that is relevant to and important to consumers, and the safe and effective use of that medicine should appear in the CMI. All of the potential side effects should appear in the CMI. But how you do that is you still have discretion and quite a bit of power as to determining how to do that. The important thing we say, or we encourage you, is to please consider the audience whenever you're doing this. You've got to keep the consumer at the center of your focus when deciding what to put into your CMI and how to present it and how to write it. But the important thing is that you can change the wording in either the headings or the body text in the summary or the full CMI for practical reasons or to improve effectiveness. It didn't take long before a sponsor brought up the fact that they have a product with an incredibly long name, and in the template, we've got places where we've got square brackets and tell you to put in the name of the medicine. Well, that medicine would would bust lines, would split over multiple lines. If you can clearly identify the product in your CMI, you can write this medicine. It doesn't have to be the name of the medicine in every line. It doesn't have to. You have the flexibility to make the template work for you, and you should be making the template work for you. The size of the font has been user tested, but it's not a regulatory requirement. If you need to decrease the size of the font in the main heading to get the name of your product on the line, you're able to do that. Those are important things to understand. There's also other resources available that are not provided by the TGA, but we're aware of and support. There's Consumer Healthcare Products Australia has a writing about medicines for people, usability guidelines for consumer medicine information that's available on their website, and we've provided in this presentation a link to that page. And then the Australian Digital Transformation Agency has a content guide, which is more about using plain English and well-structured, accessible content for consumers. So those are two more sources of information that are potentially available for you. I'll now hand over to Sylvia to discuss some next steps.
Thanks, Michael. As Michael discussed earlier within this presentation, the new CMI template, once we use it, needs to either be in PDF or HTML. And from the 1st of January next year, new medicines submitted to TGA will need to be in the new CMI template. Edweek has worked with GuildLink in developing that HTML template. So for sponsors that already distribute their CMI at point of dispense, there's a template already set up that we can use, and that way we can amend our current CMIs or even create our new CMIs using that base template. So it's similar to what we used to use for the 3-column one, and now there's the 2-column one in the new template using the HTML as the backbone. The links to external sites, so if you have links on how to use, will also be monitored by GuildLink so that the sponsors can get feedback on that. So those moving forward, sponsors are encouraged to use the new template. Having said that, you don't need to wait till 1st of January, and Novartis, as well as some of our other sponsors on Edweek, such as Sanofi and AbbVie, have already started using the new template, and some are already in the marketplace, I believe. Now, with our currently registered medication, the new template has a 5-year transition period. So basically by the 30th of December 2025, then all our CMIs will be in the new template. So we've had a few questions as to how this will happen in practice. With new applications such as major applications like new indications or new dose forms, then obviously you would submit the CMI in the new template. So that one's easy, and then the TGA review that and then provide feedback. It should be noted that the TGA do not want to review and approve our new templates. They will probably do that as part of a major application, which is just how it normally works currently. So for our current medicines, we can just start using the new template and then making sure that we take, obviously, our own interpretation of it and making sure that it's consistent with the PI, and then just rolling it out. So it doesn't need to be formally submitted and approved by TGA. Sponsors can just adapt that new template moving forward. Edwick has been working with the Reg Affairs Working Group through Medicines Australia as well as the University of Sydney in order to try and obtain an Australian research grant in developing core CMIs that can be user tested for some of our key therapeutic classes. And this is really to help sponsors use that consistent language and consistent messaging for those common therapeutic classes and having some sort of consistency amongst the CMIs. It's also great collaboration between government, industry and academia, and that's something that we've all been keen to continue in order to ultimately have the patient at the focus and not make the CMI exercise a tick the box, but really improving the readability of it and ensuring that patients can understand what they're then presented with in a very easy manner for them to be able to get the most out of their medication and understand how to use it safely and appropriately and in line with quality use of medicines. So they're probably the main points that we wanted to discuss, and I think it now opens up to question time. So I noticed that there have been a few questions that have come back and forth through the panel. So I think, Rachel, I might hand over to you to just let us know what we do now from a logistics perspective.
So I'll pass over to Avinash now, who's going to start reading some of the questions out for Michael and Sylvia to respond. Thanks, Avinash.
Thanks, Rachel. So thank you, Michael and Sylvia, for a great presentation on the new CMI template. It's obviously generated a lot of interest and some questions have come through. So I might, I'll pitch them to both of you, but and you can determine who's best suited to respond. So in the first question is, will there be some sort of education or awareness program to be rolled out to the public? This is a critical piece that all stakeholders should work on together.
Thank you, Avinash. As Sylvia had indicated in the next steps section of the presentation, there are efforts underway and continuing collaboration, particularly amongst Edwick, of which Sylvia is the chair, and also at Medicines Australia and amongst some of the other peak organisations, collaboration around CMI and the continuing improvement of CMI. That we do view that as a very important element. I think most of us can recognise that CMI, the quality of CMI is one of the issues, but also awareness and the actual distribution of CMI are two other elements of what's important about making sure that consumers have access to all the information they need. Whether or not there's going to be any large communication component to it, I think given the nature of the very long transition period that was sort of negotiated as part of the stakeholder consultation for existing medicines, we probably don't want to go out too hard and loud about the new template when there's going to be a period of time where consumers might get the old format for a little while at the same time as the new template being available for some products. So we need to strike the balance right there. And in the first instance, we want to just get the template right and get the regulatory elements right. But I think improving CMI is a job that's not ever going to really be done. And talking about CMI and making sure that consumers are aware of CMI and educating consumers about their health and medicines is a job that's just never really going to be done. So I think it's very important that these activities continue into the future. So Sylvia, did you have anything to add in that regard?
I was just going to say it's a great question because it's something that's been really behind the scenes happening and something that we've all wanted, not so much say the new template, but just CMI in general. And so I take your point, Michael, what you were saying in terms of the confusion with regards to the old template and the new template. But I guess just putting it out there and making CMI and patients knowing that they can ask their doctor, their pharmacist, or just go to our website to get a current CMI. And ensuring that patients do have that information. And you're right, it's something that's been on the cards for a while, so it would be good to see that eventuate in some way.
So another question that's come through, and again this is to both of you. So far the TGA has regulated CMIs fairly lightly compared to PIs. Presently it's up to sponsors to make sure a CMI is consistent with the PI without the need for formal approval of the CMI. The new format introduces a bit more subjectivity, example between what the TGA expects versus what the sponsor sees as most important and relevant information. Will sponsors now need to seek formal approval to update the CMI changes to make sure TGA agree they are consistent with changes to the PI?
Thank you, Avinash. At this point in time, there's no plans for any additional or extra reviewing or approving of CMIs than what has been happening as a standard practice beforehand, in that if your medicine is subject to an RMP, a risk management plan, then it's possible that the CMI, consideration of the content of the CMI would come under, a little bit more review by the TGA. But otherwise, I think the other times when CMIs might get looked at is if there's a specific safety signal that's identified that we then investigate. It may be important for us to then determine if that safety concern is adequately reflected in the PI, but also adequately then communicated to consumers in the CMI. So at this point in time, there's no plans for additional review or consideration. And I think the TGA's approach with this is in line with the fact that CMI is still the responsibility and the domain of medicine sponsors to focus on consumers and make sure that their medicines are well understood and effectively used by consumers. So no, at this point in time there isn't any additional. Did you have anything to add, Sylvia?
No, you've covered that, and I guess we just wanted to reinforce that sponsors can start using the new template and converting over without formal approval from TGA. And whenever they have a next major application, or like you said, Michael, a safety signal, then TGA will view it at that stage.
Another thing to also mention, there is the, sorry, I've just had a blank. I had a point that I was going to offer and now I've forgotten what it is. So I'll move on to the next one. If I think of it, I might come back to it.
Not a problem. Thanks, Michael and Sylvia. Another interesting question that's come through. So how should the CMIs for a new generic medicine be addressed when an innovator has not updated their CMI to the new format, particularly with regards to the updated side effects section, section 6 of the CMI, where it now makes reference to severity rather than frequency of the side effects?
Thank you, Avinash.
Michael, did you want me to take? No, you go, Michael.
Oh, okay. I was just going to say that it's important that this was one of the things that's arisen as a result of the consultation, is that a longer transition period be put into place for existing products, so that those sponsors do have a chance to make that transition where it's easier to adopt a new template in the first instance when you first register a medicine. I suppose the difficulty there is that you might have a new generic product and it may not have, the innovator product may not have adopted the template yet, but it's important to appreciate and understand that the contents of a CMI and the PI are still copyrighted material. Being the sponsor of a generic medicine still requires you to develop your own CMI. And you will still need to consider how your information is presented for health professionals and for consumers in the case of CMI for consumers in those materials. And I know that creates increased subjectivity and it is one of the requirements, one of the obligations of sponsors to do that, to undertake this work and do it well. So I don't think there's an easy answer there. The answer is that if you're registering a new generic and the innovator hasn't yet adopted the template, you still need to adopt a new template from the 1st of January 2021. So I'll just throw back to Avinash to hit us up with another question.
Okay, Michael. A question about for new submissions. Can sponsors start using the new format CMI? Absolutely, and in terms of new submissions, I think you're actually going to need to, because it's my understanding that submissions made in Q3 or Q4 will eventually result in a registration in 2021. So newly registered products in 2021 will have to have the new template. Thanks, Michael. Another question that's come through. Do all adverse events listed in a PI need to be included in the CMI using patient-friendly terms, or is it just frequent or serious adverse events? There are different practices that have been observed from different sponsors.
It is an excellent question, and elements of that question I might have to take on notice, because I'm not quite sure what the black and white answer is. I know that in my role at the TGA, one of the things that I work on is ministerial correspondence, and one of the frequent flyer questions that are asked is, or one of the issues that gets frequently raised is how well consumers are informed about side effects. Consumers are very, very concerned about side effects. They want to know about their potential, and they also want to understand the potential seriousness that they present. So I think my personal view is that most, if not all, side effects should be reflected in the CMI if it's present in the PI, because the consumer, that's the level of information I think a consumer expects and values. I might just ask Sylvia if she has a better understanding of the regulatory requirement elements of that in her experience as a Reg Affairs officer.
Yeah, thanks, Michael, and that's a really good question. So it isn't too dissimilar to what we're doing in our current CMIs, and as I discussed in the presentation, it is as much an art as it is a science. But normally we write our most common side effects, and also our most serious side effects. And you couldn't possibly cover every single side effect from the PI in the CMI. So I guess the answer is it's still the most common ones and then your most serious ones. And sometimes it's also one that may not be serious but is noticeable to a patient. So, for example, alopecia, like your hair falling out or your nails changing to a different colour, then obviously that's something that may not necessarily be as serious, however it would be noticeable to a patient and therefore would need to be included. So yeah, there's a little bit of guidance around that. And the other point is in your PI you would obviously have side effects that are not noticeable, so such as high blood pressure. You couldn't put high blood pressure because a patient wouldn't know they had high blood pressure. So if they're if they're ones that don't display symptoms, then obviously you would need a phrase within the CMI that says that some particular side effects need to be picked up either by lab tests or upon examination by your physician.
Great, thanks Sylvia. Another question that's come through, perhaps this one's directed to you, Sylvia. Are there any usability testing requirements for sponsors in the absence of core documents?
Yeah, that's actually a really good question and one that we've discussed on EdWeek. So I guess in an ideal world it would be good to user test the CMIs, but from a sponsor's perspective that is quite difficult. And so what we've done is developed that template, which has been user tested a few times now, and therefore allowed sponsors to be able to use that template as a base to developing their CMI. Some of the work that was done probably about 15, 20 years ago was developing those core CMIs where they could, and they were user tested on particular products. And therefore, once you develop the core CMIs within therapeutic classes, then when you use that and adapt it to your particular product within that therapeutic class, then you're using a CMI that's been user tested. So I guess, yeah, using that core CMI template that we've put together on the TGA website, and that's also available in HTML through GuildLink, is one that we've user tested generally. So you can use that, and then hopefully moving forward into the future, we may have a few core CMIs similar to what we had years ago to allow sponsors to write their CMIs and have a little bit more confidence that they've been user tested.
Yeah, I think from a regulatory perspective, we're not requiring user testing, but we do encourage it. It clearly has benefit from a consumer perspective to make sure that your CMIs are meeting the expectations and needs of consumers. But the TGA appreciates that it is burdensome to expect. It would be burdensome to expect every sponsor to user test every CMI for every product. So it's not required, but it is encouraged.
Thanks. Another question, and this is perhaps one that's directed to you, Michael. Is there any thinking or any long-term plans to have the TGA repository host HTML file formats as well as PDFs?
That is an excellent question. There are some changes underway that we're working on to, firstly, is to allow over-the-counter non-prescription medicine products to be able to upload their CMIs to our repository as well, because currently they're not able to. And that project is making good progress, and that's something that we'll be able to announce some progress around shortly, I think. But in terms of the format of the information that gets uploaded, look, I think there's more collaboration that's required within the stakeholder groups, GuildLink, EdWig, and the TGA as well, to try to, so that we're not all duplicating each other's efforts across the internet, and that there's already quite a lot of good work that's been done by GuildLink. I think, so from a regulatory perspective, the TGA does want to have our repository as that sort of single source of truth, but whether or not that becomes the ultimate endpoint for users to find the most, I suppose, user-friendly formats, that's still something that needs to be discussed and subject to collaboration between us as stakeholders. I know that, the whole purpose of EdWig, the Electronic Distribution Working Group, is to support and encourage digital implementation of consumer information. So I think we need to be able to work effectively together to progress those priorities. What do you think, Sylvia?
Yeah, I agree. You captured that well, Michael.
Excellent.
Great.
I might take one last question and then call it so people can get to some lunch.
So just one final one. Will this presentation be available on the TGA website?
Yeah, absolutely. As indicated in some of the pop-ups, this presentation, including audio, will be provided on the TGA website once it's finished being prepared. So you'll be able to reconsume this wonderful webinar if you like, or be able to share it with colleagues or make further reference to it later. And if there's also, as part of this presentation, there's an email address, psabcommunications@health.gov.au, where that's an inbox that I personally monitor, that I would be happy to try to get through and look at some more questions. If you have any specific questions that you feel haven't been answered, I will do my best to get some good answers to you for those.